I'm Aaron Levo, the Vice President of Communications and Public Affairs. Happy to be with you today moderating our town hall on Thursday, January the 27th. We've got a solid agenda today. We'll hope to get through it swiftly so that everybody can get back to other things. As always, the webinar will be recorded so people can view it after the fact. We'll pause for some celebrations at the end of our presentations so that we can remark on the successes we are having. And as always, too, we encourage people to post questions that you have arising from today's content using the HHS News at hhsc.ca email. We'll have that on the screen a little bit later. So take note of any questions you have. You can post them there and we'll ensure to get an answer to you very, very quickly. So with that out of the way, I'll turn it over to our President and CEO, Rob McIsaac. Rob, over to you.
Yeah, thanks very much, Aaron, and good morning, everybody, and thanks, as always, for joining. I'm going to be fairly short in my introductory remarks. As we begin, I'd like to acknowledge that we are privileged to provide care on lands that Indigenous peoples have called home for thousands of years. We recognize and respect the presence and stewardship of all Indigenous peoples as keepers of this land. Well, it's been another couple of grueling weeks since our last town hall, and I know that everybody has been continuing to manage incredibly high demands from our community. I think we can take at least some hope from the fact that although we remain highly pressured at HHS, some of the local and provincial public health data is showing some promise that relief is ahead, along with some of the modeling. So that's good, but it doesn't help us that much today. In the coming days and weeks, as the provincial government executes its reopening plan, we'll definitely monitor our situation closely and remain focused on ensuring, to the extent possible, continuity of care for our patients with the greatest need. Measures to maximize the availability of our health human resources remain in place for now. We're seeing some stabilization on this front as the number of staff and physicians self-isolating due to COVID each day has been declining. So I think that's also good news. To some extent, that is an indicator of what's happening in the broader community. Thanks to all of you who have been so flexible in your work commitments, especially those of you who have been redeployed and the folks receiving them and helping them to integrate into these new environments. This collaboration, although born out of a very difficult circumstance, is a reminder that we're all batting for the same team. So having said that, I'm going to pass it over to Sharon Pearson to provide an update on hospital operations and capacity. Sharon, over to you.
Great, thank you very much. And good morning, everyone. From an operational perspective today, you can see the numbers on the slides, slight decline in our overall COVID patient numbers across our sites at 181 today. So we were up in the 200s previously. 25 patients in the ICU, less than 5 on ECMO, and we are down to 6 active outbreaks, which is great news. We had previously been as high as 13 outbreaks. Next slide. If we look at how that's translating our pressures at the sites, our overall adult occupancy remains our greatest pressure. As an aggregate number, it's at 108%, but if we were to look at the Juravinski today, it's 119%. West Lincoln feeling inordinate pressures as well, around 118%. And the Hamilton General not too far behind. So some pretty substantive pressures being felt across those sites, along with our ICU, just like the adult ICUs across the sector are right now feeling this inordinate pressure and capacity challenges. So sitting at 97%. Our ALC patients are every day routinely between this 195 to 200 mark, again, reflecting the challenges that we have with capacity in the community related to long-term care homes, retirement homes, etc. Next slide. The capacity pressures we have In terms of the specifics around what's driving the pressures, our volumes are relatively stable. They're back to our pre-pandemic volumes, but what we are seeing is a much higher acuity for those presenting to the hospital, and that is translating in a longer length of stay. We're then challenged in terms of our throughput because of the limitations right now on health human resources and access within the community services, be that home and community care or be that within some of the congregate living settings that we have. So we continue to work with our partners in order to come up with creative strategies to address those pressures. I will highlight there is ongoing impacts to our EMS partners and our availability of ambulances because of the backlog within the emergency department. So we are meeting regularly with EMS in efforts to try to mitigate those pressures and ensure that we do not have the code zeros that results in having no ambulances available in our city. But we are putting undue stress on that service as well. Next slide. In terms of the mitigation measures, much of these we've talked about, but we are sustaining. We have upwards of 60 unfunded beds opened across our sites. We maintain the Directive 2, which is a surgical and procedural care reduction. So right now, about 50% of our activity across our sites is an aggregate number, with the exception of children's, which is ramped down to a lesser extent, but still ramped down and impacting access. We have consolidated our rehab services in order to create that GIM capacity that we are much in need of. And along with the reduction in our ambulatory clinics, the 190 plus clinics are ramped down to allow us to have health human resources to support those inpatient areas. We have sustained the closure of the UCC, and we have implemented some enhanced discharge planning and a new pilot at the Jaravinsky site to help us ensure we have no barriers or delays to discharge. We are continuing with the census balancing, so the transfers across Hamilton hospitals, across our HNHBB, and then also with the provincial process of sending patients to the GTA or to the West, typically to London and St. Catharines, et cetera. And then last, we continue to recruit, active recruitment efforts. There is an expedited recruitment with some centralized pilots in place now to ensure that we are working as quickly as we can to access the health human resources that we desperately need. And with that, I'll pass it back to Aaron.
Thanks very much, Sharon, for that update today. Next up on our agenda, we have Dr. Dominic Mertz, who is our Medical Director of Infection Prevention and Control, to give us an update on the course of the pandemic. Dominic, where are we at?
Yeah, thanks, Aaron. I will start where we had been at the last town hall when I presented around January 10th, where from a Canadian picture, we were pretty much at what we thought might be the peak or that we might be peaking. And on the next slide, you see what happened after that. So we are roughly half the number of cases per 100,000 population per week than we had been back then. Always, as I mentioned a couple of weeks ago, take this or look at the case numbers with a grain of salt, given all the changes in testing criteria. With the current testing criteria, we are sitting at 278 cases per 100,000 per week as per a couple of days ago. Next slide. This is how the epi curve in Ontario looks like currently. So we had that peak in terms of case numbers, again, with all the limitations of that. Roughly 4 weeks ago, probably we peaked 1 or 2 weeks later, but we wouldn't have seen that because of the changes in testing strategy. But despite now a change in testing strategy, we see that case numbers continue to decline, which certainly is good news and suggests that we are well past peak at this point of time. Next slide. And this now starts to translate into hospital admissions as well. Here, that's the weekly average. And you see that we probably peaked the week prior in terms of hospital admissions, which typically is 1 to maybe 2 weeks after the peak in case numbers. So we see a similar trajectory here. And ICU admissions, which is on the next slide up first, this here, again, I mentioned that the last time, this number comes with a lot of limitations, but it's roughly 55% of patients who are admitted with a positive COVID test are admitted because of COVID, and the other 45 are considered incidental cases or not the primary case of COVID. Next slide. ICU, we still, at least on the 7-day average, see still an increase, but next slide, please. When you're looking at the daily numbers and looking at the numbers today for the first time since the beginning of this peak, we have 2 days in a row with case numbers in the ICU going down. So it looks like we probably peaked in terms of ICU this week or early this week as well. And hopefully we will see the same trend as we see for hospital admissions, as well as over the last couple of weeks in terms of case numbers in the days and weeks to come. Next slide. Again, here, based on provincial data, 85% of those patients listed here have a primary diagnosis of COVID and are considered to be in the ICU because of COVID. Next slide. Hamilton View looks very similar to what I've shown you at the provincial level. You see that we are still much higher in terms of case numbers than in any of the previous waves, but certainly past peak the way this looks like. Next slide. That's our hospital admission in Hamilton. Again, very similar picture. We may have plateaued a little earlier, maybe a week earlier than the province as a whole, but in general, similar trajectory here. Next slide. Currently, the 7-day average is 9 Hamiltonians admitted per day with COVID. And this is trending down as well. Next slide. ICU admissions you see here, in contrast to the province, we already see a decrease in the 7-day average currently, again suggesting that we may have peaked a little earlier here in Hamilton than the average Ontario situation. Next slide. And we are currently on average admitting 1 Hamiltonian per day to the ICU. Next slide. One of the questions that always comes up, well, Omicron isn't really less severe, or is it really less severe, and what's happening? And this is 2-day-old data from the US where they compared the Delta period to the Omicron period. At least that's the part that I will focus on here. And you can see that in terms of case numbers here with US data up to mid-January, they had 4 times as many Omicron cases than they had during the Delta period. When you then move down on the next slide and look at the ED visits, those have only doubled, while, as I mentioned, the case numbers, the known case numbers have quadrupled. Next slide. When you look at hospital admissions, there's less than a doubling. It's a 75% increase in hospital admissions. And then most significantly on the next slide, in terms of ICU admissions, only a relatively small increase compared to what they had been dealing with during the Delta wave, despite the massively higher case numbers out in the community. And when you're looking at death, which is the last slide on this here, there's even a reduction, at least at this point of time. But again, just as a reminder, deaths are sort of the most lagging of all the metrics we have. So most likely this will result in more deaths than the Delta wave would have, but significantly larger numbers. Next slide. Another piece where it's nice to see the data, I think that was everyone's gut feeling, is that people who require hospital admission stay for shorter periods of time. And this seems to be true in this data as well, with the exception of the pediatric population, which already before had a very short average length of stay of 2 days that remained at 2 days. But you can see that in the 18 to 50-year-old, it comes down from 4 to 2, and above 50 from 6 to 4. So a significant reduction in terms of length of stay, which should help us moving forward in terms of decanting COVID patients faster than we had been able to in previous waves, hopefully. Next slide. And this is data that was presented yesterday at the city table, looking at the risk of hospitalization on the left-hand side and ICU admissions on the right-hand side as a function of vaccination status. Now, it's not age adjusted, not adjusted for any other confounding factors. So again, look at this with a grain of salt, but you can see that you see significant differences in the risk of hospitalization per 100,000 when you compare vaccinated to single, to double, to triple vaccinated folks. And for ICU admission, even a more significant effect where an unvaccinated had a 10 times higher risk than a 3 times vaccinated individual in terms of requiring hospital admissions. And that's with Omicron, obviously. So this is Omicron data and the effect that vaccines have on Omicron infection. Final slide, please. So bottom line here is vaccines work against Omicron, and if you hear otherwise, that's not true. It still protects very well from hospital admissions and ICU admissions. Omicron is less severe at the individual level, but I think we've all heard that repeatedly at this point. But the very large number of cases that we had out in the community, despite Omicron being less severe and despite the fact that vaccines work, resulted in the strain of the hospital system that we've seen over the last few weeks. But it's not a sign that vaccines no longer work. Handing over back to you, Aaron. Thank you.
Thanks very much, Dr. Mertz. Always informative. Thank you. Next up, we have on our agenda Bruce Squires, who's our Vice President of Women's and Children's Health, who's going to give us an update on the ongoing work of the President's EDI Advisory Council and our work on equity, diversity, inclusion. So Bruce, over to you.
Thanks very much, Aaron. Good morning, folks. It's my pleasure to have an opportunity again on behalf of Doctors Smita Halder, Sanjay Sharma, and myself as the co-chairs, but also the more than 50 of your colleagues from across HHS who have been participating on the President's Advisory Council on equity, diversity, and inclusion. That group is continuing to work towards a spring goal of a set of recommendations to advance equity, diversity, and inclusion across all of HHS. There's been key activities to inform the development of those recommendations, in particular the recent EDI workforce survey, as well as a number of key informant interviews. And the next, and finally, a policy review that really has looked at over 60 policies at HHS to identify opportunities to improve. We have recently completed that EDI workforce survey, and a huge thanks. Despite all that's going on, more than 3,700 individuals from across HHS participated in that survey, and it's a great piece of input to this work. The next phase is taking us to some focus groups, a number of focus groups to explore, what have we learned to date, and what else on which can we focus. That's going to really kind of culminate together in what you would call sort of a current state assessment. What does it look like here? And then sort of an identification of what are the gaps, what are the big opportunities to move forward, and all of that, you put it together, and that really results in the set of recommendations. But as I said, the next key step is a set of focus groups of our entire workforce. And so to talk to you about that, I'm pleased to introduce a brief taped message from Dr. Smita Halder, who wasn't able to join us today live, but here she is virtually.
Hi, I'm Smita Halder, and I'm the co-chair of the Equity, Diversity and Inclusion Council at HHS. We are a top-performing hospital, And we want that to include our focus on EDI. But we're not there yet, and our work continues to evolve. We've gathered input from across HHS in a variety of ways over the past several months. Thank you to everyone who participated in the recent EDI survey. We've also conducted stakeholder interviews and reviewed the policies. Your responses and other inputs have identified key areas we wish to explore further in focus groups. These are going to help us better understand the lived experience of our team members. We've built in flexible options so you can participate in a virtual focus group or through a self-guided option online at your own pace. The focus groups will be facilitated by an external partner, and all input provided will remain anonymous. More information about the focus groups, including key dates and how to participate, will be available in the usual locations, including on the hub. We recognise the many demands on everyone's time, and we're grateful for your contributions in this important work. Working together, we look forward to creating an HHS where everyone feels welcome and included.
A huge thanks to Dr. Halder. Just go back to the so as she said, everyone recognizes what a busy time this is for teams at HHS, and so what we've tried to put together are flexible options for participation. There's the live virtual approach. Those will have varying time lengths of each of those sessions. And so encouraging folks to sign up by January 31st to be included in one of those live focus groups. And I'll give you a way to sign up in a second. There's also the self-guided online tool option. So in this case, you can do it at your really at your leisure, at a time that works best for you. Take about 15 to 20 minutes to complete the focus group survey. You don't need to sign up. You just need to endeavor to finish that focus group by February 3rd. Lots of more information is going to be shared. Daily Dispatch, the hub as key distribution mechanisms. So, this is in the context, again, of recognizing the enormous demands on your time. And so I know that Smita and Sanjay and I are all truly grateful for the contributions that you've already made to this important work. And we hope you'll be able to participate in this next phase. If we go to the next slide, here's a way to do that right now. If you're interested in looking at the live virtual option for focus group participation, then if you hover your phone over the first barcode, you can be taken to the sign up tool. You can do the same with the self-guided online tool through the other barcode. And of course, you're welcome to do both. So truly hope that you'll take this opportunity to dive in a little bit more to tell us what you think is important in moving us forward on our equity, diversity, and inclusion journey. With that, Aaron, I'll turn it back over to you.
Awesome. Thanks very much, Bruce. Okay, next up on our agenda, I will introduce Tiffany Roblin, our Director of Employee Labor Relations and Human Rights, who's going to talk to us a little bit about our efforts right now on Black History Month coming up this February. So Tiffany, over to you.
Thanks, Aaron. As folks are no doubt aware, February is Black History Month. Black History Month is an opportunity to celebrate Black history and culture and learn more about the stories and contributions of Black Canadians to the growth and development of our nation. Black History Month is celebrated in February to coincide with the birthdays of Abraham Lincoln and Frederick Douglass. While Black History Month is an important opportunity to learn more, we should not confine our efforts to learn more about Black contributions, systemic anti-Black racism in Canadian society, amongst other history, to February only. We should be educating ourselves every day. Folks may recall that in September, the Human Rights and Inclusion team collaborated with Indigenous staff and physicians to develop a calendar of learning opportunities for Orange Shirt Day and National Truth and Reconciliation Day. Because this calendar was so well received, the team has collaborated with a number of our Black physicians and staff across HHS to create a Black History Month calendar of learning opportunities. A screenshot is there for you. A link to this calendar will be available in the Hub post on February 1st, but alternatively, it can be located today on the Human Rights and Inclusion Team Hub page. Included in this calendar are ways to recognize and celebrate Black History Month in the community, including events from McMaster University, Sick Kids in Toronto, and the Hamilton Public Library. Along with the calendar of learning opportunities, the team is also hosting and coordinating a number of initiatives this month to recognize Black History Month. On February 3rd, the team will be launching a Black Employee Affinity Group for Black staff, physicians, learners, and volunteers. The group will meet for a second time later in the month. On February 16th, the Volunteer Association and Nutrition Services teams are offering a Black History Month Day in the cafeterias. On February 18th, we will be hosting a Zoom film screening of Desmond Cole's The Skin We're In. This is a 45-minute documentary, and hopefully some folks have the opportunity to participate. For the week of February 22nd, we are encouraging everyone at HHS to complete the Ontario Human Rights Commission's 30-minute e-learning module entitled Call It Out, Racism, Racial Discrimination, and Human Rights. This e-learning has been added to our LMS system and can be accessed via the My Learning app in Citrix. Lastly, on February 25th, the team will be hosting a discussion space for folks to share what they learned from that e-learning module, Call It Out, as well as to ask more questions. Details of all of these upcoming events will be shared again in the Hub story on February 1st. And with that, I'll turn things back to you, Aaron.
Great, thanks very much for that update, Tiffany. Some nice resources there for sure for everyone to get engaged. Next up on our agenda, I'd like to invite Dr. Barry Lum to join us, who's going to give an update on our commitment to Odyssey, the ongoing work that's been happening to advance this important transformation. Barry, where are we at and what do we need to know?
Thanks, Aaron. Hi, everybody. First of all, on behalf of the Odyssey team, I'd really like to take a moment to express our sincere thanks and quite frankly, our awe at the many, many people from across HHS who've helped serve our community during the most grueling wave of the pandemic. It has truly been remarkable. And we know that each of you have responsibilities both in the clinical and the administrative world that would be difficult on a good day, let alone in the middle of a pandemic. So we just want to say that we know how hard everybody is working and we're very proud to be part of HHS. And considering the impact of the pandemic, I know it's a challenging prospect for you to think about how we're going to press forward with the renewal of the hospital information system. But truth be told, we've been on this journey for the last 3 years to establish a modern electronic health record for HHS, and we're really close to being done. The Odyssey team has tried very hard, especially during the Omicron phase, to minimize our impact on the clinical operations of the organization. And they have been working very hard in the background and continue to make steady progress. So, you know, at this point, we're really close to the end of the journey. We can see the finish line. And I want to emphasize again why it's important that we just keep our foot on the pedal and get to go live. I do want you to know that we're not alone. You know, in Ontario, over these last 2 years, Trillium Health has gone live with Epic. Our colleagues at the Central East Cluster went live just last month. And our colleagues at University Health Network in Toronto are actually on exactly the same path of us with exactly the same go live date. And they're struggling just as we are, but they're also pushing forward. And you know, I would hope that you wouldn't lose sight of the fact that at the end of the day, this is about the quality and safety of our patient care, and that Epic will move us light years forward. It'll also make our ability to continue to recover from the pandemic stronger, and also our ability to deal with the next crisis as it comes along. And I truly believe that once we get through the go live, that you will find that your work is easier and more satisfying in the Epic environment. Next slide, please. So as I said earlier, the journey to install Epic has been in progress for some time. This slide will be familiar to you and shows our roadmap and really shows that we have completed 3 of the 5 phases of the work to get to the moment when we can turn on the system. We're now entering the final push before we go live on June 4th, which is really only 127 days away. Everyone who is involved in any aspect of patient care will learn the new system through training and a number of readiness activities that are planned over these next 127 days. You'll get to see how things work, what the flow will be like through a whole variety of demonstrations. And everyone at HHS will be trained to use the system properly. You will get time provided to you for the training. You'll be supported by your leaders as we go forward. You will have the help of super users at the time of go live and many other activities and supports. So the scheduling of the training is happening now, and I'm going to say a few more words about that on the next slide. And we will, between now and June, be proceeding step by step through a whole variety of other activities beyond just training to get us to the point that we can, in fact, flip the switch. The training program this spring is the most important thing we will all do together to launch the EPIC system. If you haven't yet been directly involved in the project, this will be your time to see what everybody's been talking about. As of this week, your leaders will begin the process of organizing and registering their teams, your individual teams, in in-class training. You'll receive a confirmation email as your leader registers you. And this will likely take some time. There's a lot of people, almost 13,000 people who need to be trained and registered. So if you don't hear about it today, that doesn't mean it's not happening in the background. Everybody will be registered by mid-March, and the formal in-class training will start at the very end of March and into April and May. In the meantime, everyone who will eventually use EPIC will need to complete a series of e-learning modules before they set foot in the actual in-class training. And these are available now in the My Learning portal. They're really not difficult. It's a series of short videos that take you through various aspects of the system. Each one takes a few minutes and has a little short evaluation at the end. It's recommended that if you can find the time to do this during your working hours, that you do it then. But if not, the appropriate provisions will be made for you to be able to get these taken care of. If you've got questions on this, please don't be shy to email us at epictraining@hhsc.ca if you've got any questions. Next slide, please. So look, in addition to all of that training activity that's going on, there are a number of other upcoming events and activities that we need to get through in terms of being ready for go live. Many of these activities are not unlike a dress rehearsal, and in fact, we call it dress rehearsal in some circumstances. We'll be actively running through different scenarios, both clinical and on the technical side of the house, over and over again to be sure that we're ready when we actually start to use the system. Starting in February, members of the Odyssey project team will begin testing all of the devices across the entire organization that will be used to run EPIC. And you may well see some of these folks on the units as they come to test every device, every printer, every label printer, and so on. If it turns out that a device doesn't pass the audition, then that will be dealt with, and we'll be putting together all the potential contingencies we can so that if there are difficulties on June the 4th, we can deal with that. More information about the technical dress rehearsal is also available on the hub or through your leader, and you'll be hearing more about other readiness activities as we go along in the coming weeks. If you haven't yet heard about Day in the Life cards, please take the opportunity to check those out on the hub as well. Next slide. So as I said in the beginning, it's really been quite awe-inspiring to watch the work that everybody's been doing during this important clinical transformation. And I do want you to know that it's not that long until we'll be moving into the EPIC world, which is really the world-class electronic health record. If we had a crystal ball this time 2 years ago, we might have paused or said, oh, this might not be the right time, but we're past that now. We're very close to the end, and we really want to ask you to just hang in there with us and help us get us to the point where we can truly say that we're a modern academic hospital. In the last slide, I just take a quote from Chris Hadfield. It says, "Don't wait to walk on the moon to notice the 1,000 small victories that got you there." And this really refers to the incredible amount of work that will have been done by the time we get to go live. And I would just ask you to be proud of that. And as again, just stay with us a bit longer. And thank you. Back to you, Aaron.
Thanks very much, Barry. A nice quote there from Commander Hadfield. Okay, so as I said at the outset of today's town hall, if you've heard something that raises a question in your mind, you can certainly send those questions to hhsnews@hhsc.ca. Our process to get you an answer will be swift, and we'll be able to answer any questions that come our way. So please email questions. Also, if you have suggestions about content for our next town hall 2 weeks from today. Next slide, please. Okay, so moving forward now for our celebrations. I know 2 weeks ago we had a high watermark day in terms of our celebrations, so hopefully we can at least match that today. I would invite our participants and our panelists to please either type a celebration into the chat forum or raise your hand to give a celebration live. You can shout out to those you work with, something you've seen in our organization, maybe something you've seen outside the organization that you want to call out that's had an impact on us. But now's the time if you wish to celebrate your colleagues, your team, or something you've seen. I see Bruce Squires with a hand up. Bruce, what would you like to celebrate today?
Thanks, Aaron. Maybe a quick PSA leading into a celebration. So today is National Kids and Vaccines Day, and on top of a number of town halls and educational events for parents and for children and providers across the country, here at HHS in Hamilton, we have the province's GoVax bus parked right outside the Ron Joyce Children's Health Center and offering walk-up vaccinations to children who are eligible. And so I want to make folks aware of that. Encourage you, if you know anyone, to send down. Lots of capacity, and use that as an opportunity to thank the drivers of that, including Tracy Akit and Trish Wilson, our security team, and many others who have helped to make this another key part of the ongoing efforts to get our community vaccinated. So thank you for all of that.
Awesome, thanks, Bruce. And I see Dr. Michael Stacey, you have a hand up. What would you like to celebrate today?
Yeah, thanks, Aaron. I really just wanted to call out all of those people who've been involved in the command center calls at the Juravinski Hospital over the last month. They've been happening daily and sometimes more than once a day to try and deal with all the pressures that exist at that site, and lots of really hard, dedicated work by the teams there to try and ensure that we have the capacity for the patients that we need at that site. So well done to everyone. I know the work isn't finished and they're still in the midst of it, but just wanted to acknowledge the really hard work they're all doing.
Perfect, thank you very much. I'll just read a couple from our chat forum here. I have one from Morgan Richardson celebrating the tremendous work that's been done by our point of entry screeners alongside our site leads that help to keep us all safe. Thank you very much. That's a great one, Morgan. Thanks for that. One also from Louise McCrae. Thanks to Andrew Harrison and his team at the Hamilton General Hospital site for the rapid installation of barriers in our step-down units to help keep our staff protected. Thanks for that, Louise. One also here from someone with an email handle with the support of Mark Jefferson and infection control. I'd like to acknowledge the team on B3 North for their hard work to get out of the outbreak while still supporting complex patients. Wendy Seidlitz here says 5 months CLABSI MBI free at Master Children's Hospital, which is a record. Way to go, pediatric team members. Erica Casperson with a shout out to Julie Freeman on the EPIC team for the awesome work with the behavior safety risk build. Always inspiring, responsive, and professional. Excited to share her great work in simplifying and streamlining this important process. And I see a few of our panelists with hands up. So I'll go first to Kirsten Kroll. Kirsten, what would you like to celebrate today?
Hi there. I wanted to acknowledge we've got more than 300 people now deployed across HHS into our inpatient areas. I know this has been extremely challenging, but so important to carry on with the best care that we can with our patients. We know people are doing the very best that they can. It's been a lot of adaptation and trying to find ways to switch out routines and reassign work a little differently. It takes a lot of collaboration for sure. I just wanted to do a shout out. We know a lot of energy and efforts going into this, and people have really been extremely generous in going through this change and enduring all the pressures that we are experiencing. And, you know, there's many stresses out there that people are feeling, you know, I'm not doing the care I really want to deliver. We know that it is the best we can do right now, and appreciate, you know, people are always competent in what they're doing, seeking support, but also doing the shout outs for each other as well. So thank you from our hearts for helping to take care of our patients the best way we can right now. Thanks.
Awesome. Thanks, Kirsten. I see some other colleagues with hands up. I'll go first to Leslie Gillies, then Dave and Leslie Gauthier. So Leslie Gillies, what would you like to celebrate today?
Oh, thanks, Aaron. I just building on Michael's comment. Thank you to, you know, obviously the staff and the team and physicians and leaders at JH, but also the West Lincoln sites who have been particularly experiencing intense pressures with high numbers of admissions, both COVID and non-COVID. But also thank you to St. Peter's and to Satellite Health Facility for all the additional support that's allowed us to facilitate an increased and unprecedented number of transfers. And without that support, we would have been in rough shape. So thank you very much to all of those teams.
Awesome. Thanks very much. Dave, next up to you. What would you like to celebrate today?
Thanks, Aaron. Well, a couple of things, I guess. First, just a thanks for all those that have continued to be involved in the many and different ways that we've been trying to support our staff and patients and swabs and vaccines. You know, certainly the West End Clinic has been like the poster child for being able to be flexible. We certainly are happy to continue to be offering PCR swabs there dedicated for our staff, mobile or within hospital vaccine efforts and outbreak units, all the rest of it. Certainly acknowledge we had a couple of bumps as we got self-collection of swabs going this week, but very pleased and thank you for the work to enable that also as a more convenient way for our staff to get access to those testing. So that involved a lot of different folks from lab, employee health services and the like. So just thanks to you know, Lucas and his team. So thanks for everyone and all they continue to do.
Thanks very much, Dave. Leslie Gauthier, what would you like to celebrate today?
So Dave and I are just debating who gets to share this celebration. So we spent some time this morning at the Juravinski Hospital in the pharmacy department and saw all of the big new robots and pharmacy automation that has gone live this week. And appreciating as anything goes live, there's been a few little bumps, but just really wanted to say a huge thank you to the pharmacy teams, especially Kim and Nancy, the managers who have been leading this work. And really important to acknowledge this is big change for the frontline nurses. And we know there were a couple blips in the last 24 hours, but I think things are landing in a really good spot today and just a great celebration. The pharmacy automation is a huge enabler to Odyssey going live. So thanks to everyone.
For sure. Thanks for pointing that out. Great. Kelly Campbell, what would you like to celebrate today?
Yeah, thanks, Aaron. I just want to shout out to our Hamilton Health Sciences Volunteer Association colleagues that have been working very hard over the last 2 weeks and into the next week to provide the free beverages to our staff and physicians. They are struggling with their own staffing shortages and struggling to keep, you know, at least one food service operation open at each site. So really want to thank them for their efforts and their continued collaboration and support.
Superb. Thank you very much for that. Okay, I'm going to read a couple of more from Marcy Stacks-Braithwaite today. Today is National Holocaust Remembrance Day. Thanks for pointing that out, Marcy. That's really important to know. From Rachel F. Today is also International Holocaust Remembrance Day. So thank you for that too. Shout outs for that. A good reminder. May we never forget. It might be important to mention this while speaking out about equity and diversity and inclusion, for sure. Thanks very much for including that today. Make sure that we get something out too on our social media channels. I'd like to set up from Liliana. I would like to celebrate HHS leaders and executives. I recently joined HHS and I've been impressed by our leaders, all very approachable and humble attitude. Keep it up, great attitude. Well, that's nice to hear. Good stuff. Thanks for sharing that, Liliana. From Monica B. As a newly redeployed staff person who has moved from 2 years at my home office on my dining room table to E4 and F4 at JH, I'm awed and humbled by the amazing people who do such important work. They are rock stars. Wonderful. Thanks, Monica. From Susan Fucciarelli, thanks to all the redeployed staff in EHS, along with the Employee Health Services nurses for their ongoing efforts to respond to high volumes of calls and provide guidance and support to our staff and physicians during these past few weeks. For sure. Thanks, Susan. From our QCC consultants, thank you to Leslie Gillies, who has been incredibly present, compassionate, and supportive while covering a portion of Dr. Meyer's former portfolio, Dr. Ralph Meyer. Thanks very much for that. Great to see for Leslie. Thank you, Leslie. From Betty Enns, 6S staff, amazing care of my daughter. That's great when the care is personal and you get to remark on it. Thanks for highlighting that. From Andrea Frolick, thanks to the psychospiritual care team for your on-the-ground psychological staff support for our staff, physicians, learners, and leaders. Appreciate your creative and compassionate approach to promoting resilience and well-being at the front lines. Resilience support available to all at resilience@hhsc.ca. You can also check the hub for more details and more supports there as well. Thanks, Andrea. From Kavita Demanasker, on behalf of Karen Finley and myself, shout out to all the DI techs for making all their efforts to accomplish imaging for all ER and IP in timely fashion within 24 to 48 hours. Super. Thanks very much for highlighting that, Kavita. Lisa Ballantyne, congratulations to Janice Hatton, CSS leader, for her retirement after 30 plus years of hard work and dedication. Thank you very much. Thanks, Janice, and congratulations. From Deb Rackenjack, to everyone, to every healthcare worker that may feel disrespected by the convoy fighting vaccine mandates, I appreciate all that you're doing. So thank you very much, Deb. From Donna LaForce, to everyone, thanks to our comms team for keeping us so well informed. Your efforts are very much appreciated. Thanks, Donna, very much. Okay, well, we've had a very solid outpouring of gratitude today. Maybe one last one here just came in from Denise Berry. We cannot forget our cleaning staff, porters, and background workers who keep the behind the scenes running. Your efforts do not go unnoticed. They certainly do not. Thank you very much, Denise. And thanks to all of you for participating today. Appreciate you making time. Maybe in closing, if our CEO is still with us, Rob, final words to you.
Thanks, Aaron. Well, thanks everybody for attending, and it's sort of second town hall in a row where we had so many celebrations. Again, from my perspective, very heartening. It's been a very difficult couple of weeks. So I think it's awesome that people have hung in as they have, and we're all very grateful for it. I think we are seeing some green sprouts that would indicate things might be leveling off, and we might start to see some easing of the pressure. But in the meantime, really appreciate everybody's work, and thanks again for sharing your time today with us, and we'll see you next time in a couple of weeks. Cheers, everyone.